We have a quorum here, and so we'll go ahead and get started. I know we've have several folks that may be coming in and out, and I believe Senator Watson will be here in a minute. But we'll go ahead and get started with H.R. 340, which is Representative Clark's urging resolution. And we're going to hear, let me just remind the members of the committee, this is a rather unique committee that we have. We cannot technically make changes to any piece of legislation, but we can make recommendations, which is what we did on HB 65, the medical cannabis expansion bill, most of which were adopted and put into the legislation that was passed by the House last week. And so that's what we're going to do today as well. We're going to hear two matters. Representative Clark's H.R. 340, which is the urging resolution, and then Senator Watson's SB 16, which is the legislation that was passed by the Senate. So, everybody good with kind of the game plan? That's what we'll do. We will hear, if there are some folks that want to hear speak, we will provide some testimony, very brief testimony if there are folks that here want to speak. That's what I do. So, Representative Clark, why don't you got the floor, and let's see. You want to help me right there? Try that.
All right. Thank you, Mr. Chairman and members of the committee. I have a House Resolution 340. It's LC 1150202. And all this resolution does is it makes the request of Congress to change their policies regarding marijuana and hemp to allow states to set their own regulatory policies and regulate it at the state level and local level, not at the federal level. That's really all this is doing. And if y'all have any questions, I'm open to hearing any.
Okay.
Again, it's not going to wouldn't make marijuana legal, recreational uses legal. We would be able to still set those kind of policies here in Georgia.
It's basically just an urging resolution asking Congress to let states do it, leave it alone when it comes to recreational use.
That's right.
Is that right, for
yes, sir.
Medicinal purposes? Okay. Are there questions for Representative Clark from members of the committee? Representative Gravely.
Thank you, Mr. Chairman. This resolution, correct me if I'm wrong, is specifically to allow, if Congress did reschedule from 1 to 2, would simply allow for research and development across the state and universities, or maybe even some medical facilities that wanted to partner to allow for further research and development without the fear of maybe federal funding or a license being taken away or criminal prosecution. Is that correct?
That's correct. It would just be whatever, asking them to change their policy at the federal level so that if we wanted to, one of the things right now, we've gone about as far as you can go legally in the state of Georgia with medical cannabis oil, and but we can't cultivate in state because we're afraid of losing federal funding for our universities, and we would regulate that with. And so if they change their policies, we could set the regulatory policies in the state without our universities that we regulate to grow. They wouldn't lose federal funding. That's correct. And then you could, it's just one of those things economically I think we're missing out on being able to do high-paying jobs to do research and development with. I mean, there's things that we probably don't even know right now that could positively be benefited, whether medicinal uses, other health uses, and things like that we don't even know because people can't do research and development, at least legally.
Representative Clark, let me just ask a real quick question too on that. And there is actually a program in Louisiana that we've had discussions among members, and in fact even with the chairman of the Judiciary Non-Civil, that allows in-state cultivation but only at universities, and it's been in place for a couple of years now, and they've allowed the licenses to be able to cultivate, process, and distribute cannabis at LSU and Southern University, I believe. And if we were to have a program like that, your urging resolution would encourage Congress to allow regulatory structures similar to that. Is that not correct?
Absolutely. Or that we in Georgia could do it, regulate the growth, cultivation how we see fit. You couldn't grow it in your backyard, but UGA, Emory, Fort Valley State
ABAC.
University, ABAC, all
Yeah.
those universities, we could allow them to cultivate and do some research and development with, sure.
That's right. Okay. Representative Stovall, you got a question?
Thank you, Representative Heath Clark. I do have a question on line 10, where you kind of specify intractable epilepsy and sometimes other conditions. Was it a reason why you just had intractable epilepsy and not listed everything else, or why was it just that one listed first?
It's to be as broad, because states that normally start introducing the medical cannabis oil, I believe like the whole thing started with people having epileptic seizures, and so that was kind of like the start of the medical cannabis oil. So most states, that was their starting ground, and some states have gone further than other states. So that's why it's like that with the epilepsy and other in some other states with other conditions.
Okay, thank you.
Any other questions for Representative Clark? Just for the knowledge of this committee, there are not many times the Senate passes things that may be of value to us, but they have, just for the knowledge of the committee, they did pass a resolution, Senate Resolution 317, that's been introduced that identifies this statement: there are strong anecdotal reports of successful use of medical marijuana by children for the treatment of a variety of health conditions ranging from seizure disorders to autism. And they have asked that they have put their own resolution asking Congress to amend the Controlled Substance Act of 1970 to reduce marijuana as a Schedule I controlled substance. Would you, and maybe I'm asking to the members of the committee as a recommendation, would you be open to a recommendation that would actually put in your resolution urging Congress to reschedule marijuana specifically from Schedule I and to possibly look at descheduling CBD? Is that something that you would be amenable to, and a substitute that would be presented to the Judiciary Non-Civil Committee?
Yes, sir. Whatever we think is the strongest message that we could get out of the House and send to our federal delegation to encourage them to support that.
Okay.
I'm game for whatever we can send with the loudest, strongest, most what's the word I'm looking for? Unified voice from the House.
Yeah. Well, it may be that if the Senate has their own version, and that it may be prudent for us to do that as well too. So I'm going to ask the members of the committee if there is any objection to us adding that type of language to, or recommending that Representative Clark add that to his urging resolution of what would be before Judiciary Non-Civil. Is there any objection to that or any discussion about it from the members of the committee? Anybody see an issue or problem with that? Okay. Well, why don't we just we'll make that recommendation. All those in favor of making a recommendation to add another paragraph to the resolution to reschedule marijuana from Schedule I and descheduling CBD. All those in favor say aye. Aye. Any opposed? Okay, we'll move forward with that.
All right. I also know that there's a bill in Congress right now dealing with this issue. I'm not sure of the number.
It is H.R. 715.
Do you think that we should include H.R. 715? Is that correct?
H.R. 715 is correct.
Do we want to add the language to support that bill?
I tell you what, since the members of this committee do not have that bill,
Okay.
and so they'd be making a decision on something they don't have in front of them, why don't we leave that for you at your discretion to bring that up with Chairman Golick in the Judiciary Non-Civil Committee?
Okay.
How about that?
Yes, sir.
I think that probably might be the proper. To the best of my knowledge, the bill by a congressman out of Virginia, a Republican out of Virginia, basically reschedules marijuana from Schedule I, deschedules CBD, and allows states to determine what is reasonable in their own states. So So it's very similar to what we're doing, but why don't we have that conversation
Okay.
with Chairman Gold?
Yes, sir.
Very good. Any other questions for Representative Clark? Let me get you on there. What number are you? 7? There
Yes,
you go.
sir. I think it should be noted that I believe here in Georgia we have the best agricultural, research development, and medical institutes and universities in the South. I would put them on a national level as well among their standing. And if Congress were to act to do this, I believe the possibilities and the opportunities for those institutes and universities would be unlimited here in the state of Georgia to be able to perfect research and development and give our state the opportunity to possibly lead the way on this.
In fact, I've had conversations with the folks at ABAC. I don't know, Chairman England, I don't know if you've had any conversations with them, whether they approached this about this at all, but about initiating a program if it were allowed under state law. So, Representative Clark, thank you. Appreciate you being here. Thank you for bringing your bill before us, too.
All right. Appreciate it. Thank you, guys.
Let's see. Senator Watson is not here. I tell you what. All right. He is coming, so if we'll just stand at ease for a minute, he should be here. Thank you, Representative Clark. Yeah, he's coming, be on his way, so if y'all don't mind, we'll just hang tight for just a minute and let him, well, we got the committee here. While we're waiting, are there any members of the audience that would like to testify on behalf of either the resolution or regarding SB 16, the Senate bill? Okay. Hey, Senator Watson, we're waiting on you, so come on up. I know we messed around with time a little. Oh, whoops. That may have been me, sorry. Yeah, I know, and I think everybody's been over there. I'll take the blame for that one, so sorry about that. You want to catch your breath for a minute? We're going to chat about your SB 16. All the members of the committee have the bill in front of them. And so why don't you tell us a little bit about your bill? I think most of us know about it, but why don't you tell us about it and kind of the logic behind where you're going with it? The floor is yours.
Thank you, Chairman P. The Senate Bill 16 does just a couple things. One, introduces the percentage of THC from 5% to 3%, and the other is the abstinence diagnosis of autism. And that's basically it.
Okay.
Be happy to entertain questions.
I think there probably will be some. Senator Watson, just so you know the procedure and process what we're going through. This is a special committee. set up by the Speaker of the House to take a look at all medical cannabis legislation before it goes to a specific working committee. And so we won't be making any changes to your bill today, but we will make possibly some recommendations that would be delivered to Chairman Rich Golick of the Judiciary Non-Civil, which is where the bill would go next. And so that's the process and posture we're in today. So any questions for Chairman Watson? Let's see. Representative Clark. Caldwell. I'm sorry.
No problem. Thank you. Senator, thank you for being here. Appreciate the legislation. Can you help me understand? I see the reduction from 5 to 3. I guess if none of us asked it, we'd be remiss in what we're doing here. I guess the question is why, right? Do we have examples of abuse that we've seen throughout the state? Are we rampant with 5% high children?
Correct. That's a good question and fair, and we've been asked and answered
multiple times, and we're in the House, so we're all starting over again. The Senate felt that in the past, it had gone down from 15% to 5%. So 15% back in the 70s or 80s or so, never used. And then how we came to the 5% versus 3% versus 0.3% versus 0.5% versus 1%. All of those numbers were used 2 years ago. And then, so if you look at the states that do this, you have recreational marijuana in about, I think it's 8 states, maybe District of Columbia. You have about 20-something states, maybe 22 or so, maybe. Chairman Pete can give me the numbers.
Sure. Yeah, there are 28 states that have
28 states.
medical
So
cannabis legislation.
about half and half do no restrictions, and the other half is about 12 states that do restrictions, like the state of Georgia. Virginia does, I think, 3%.
Actually 5%.
I'm sorry, Virginia does 5%. There's another state, maybe Delaware, Connecticut, that does 7%. And then Alabama does 3%. And then all the rest are mailable amounts of THC, so the hemp oil. And those do take care of many of the patients that we have here in the state of Georgia. So that's 1% or below, I think, is the mailable number. So several of those states have 0.3, 0.5, and then 1%. Then there are about 5 states that have not touched it at all. And again, those numbers may not be exact. But that's how we came up with that. That's where we are. That's what the Senate passed. You'll notice that there's several members of the Senate still feel as if that's too much, that feel as if there are no randomized controlled trials that do this, and that's what we base science on. That's the way we practice medicine. There are a lot of anecdotal reports. There are a lot of associations, and I am not here to tell you that I do not think that it doesn't work. I'm here to tell you that I think that CBD, cannabidiol, does have a place in healthcare. I think that a percentage of THC may also play a role, but I don't think anybody in this room, anybody in the audience can say what that percentage is. And I think that until the federal government gets off, breaks down that wall, as I said in the Senate, until they break down that wall and take it out of Schedule 1 to a Schedule 1B or some derivative thereof, and allows us to study this in a very controlled fashion, placebo, double-blinded, randomized controlled trials, however you want to structure that, then I think until we have that, I don't think anybody can say what the right percentage is. Anecdotally, it certainly works. I think that is without a doubt. So that's a long-winded way of saying that, but that's where we are.
Chairman, follow up?
Yes, sir.
Thank you. Thank you. I guess I appreciate the answer, and I appreciate the research. I guess part of my problem is what I think I'm hearing is we don't have any data.
Well, we have a lot of observational data. We have anecdotal data, but to get FDA approval or to get to how we should do this from a science basis, you're correct that that data is not there.
So is that not as much an argument for no change and sticking with what we do assume is working? Or
well, listen, we're in the House. We can you can do what you want to do. But it's got to come back to the Senate too. So that's where we are.
Okay. Thank you, Senator.
Just so we'll all make sure we're working off the same numbers, here's where the United States is. There are 28 states that have full-blown medical marijuana legislation in their state. Of those 28, 8 of them are full-blown recreational. So, but 28 states have full-blown that have no THC limit whatsoever. Therefore, there's no cap. I mean, whatsoever. There are 14 states that have low THC oil programs similar to Georgia. And of the 14, the ones that you were chatting, Georgia has 5%, Virginia has 5%, I think Delaware has 7%, and there are several, I think, at 3% and less. So that's for the members of the committee. That's where we are in the U.S. on this particular issue. So, Representative Gravely.
Thank you, Senator. If not the same line of questioning, but my concern being with the reduction from 5% to 3%. If the governor were to sign this bill as is, what would happen in the state of Georgia under Georgia laws to those families who are registered with the state, currently in possession of a THC oil that is 5%, and due to the diagnosis that they possibly have had a titration up to maybe 4% or 4.5%, above that 3% level, what would happen with those families in the state that are legally registered with the state, in possession of the oil, treating with the oil, if this bill were to become law?
Well, I presume there's going to be a transition. If the governor signed it, so it would go into effect July 1st, and there'd be a transition there, same as what it was before this law passed in 2015.
If I may further on, would they under this bill, would they be breaking the law at that point?
They're breaking the law now. Don't fool yourself now.
I understand.
So to say that they're not breaking the law now, and I think that everybody here that voted for that understands that, and I voted for it too, and I was a second signer when I was in the House.
Absolutely.
So to say that they're breaking the law, they are. You're right. That's correct. And I will tell you what, if I had a child in their situation, I think there are laws that are bigger than man. We make man-made laws, but there are laws that are bigger than us. And I feel very strongly that, yes, you'll go above and beyond, for your child. And in situations that we have heard testified in the House and in the Senate, I think that all is, I think that we have found that overwhelmingly to be the case.
If I may furthermore, but to specifically that for that family in the state of Georgia, like I said, maybe is at 4%. They're treating with 4%. They've seen some positive results at 4, maybe 4.5.
Listen, I got you. I see where you're heading. I agree with you. I see you're making a good point. We make those decisions, and I would not want to get into what the physician or patient relationship is here. Mm-hmm. I don't think that's where I want to be as a practicing physician.
Okay. And final question, just if we understand they are breaking the law, they'd still be breaking the law at 3% too, correct? Yeah. Okay. Okay. Thank you.
All right. Any other questions for Senator Watson? Okay, Senator Watson, I think we saw a strong indication last week with a vote. Hang on, we got a question from Chairman Ingham. Chairman Ingham? Or Chairman Call.
Thanks, sir. And this goes not to the level, but to the last paragraph about autism.
Mm-hmm.
And I hadn't got all that language where it says see paragraph G and all that kind of stuff in front of me. Is this suggesting that autism is the only thing we need to be adding, or is this adding this to what we added in the House?
No, this would add autism spectrum disorder only.
Only,
Right.
and not the rest of the ones that we put on.
I
in the House
don't.
bill.
I haven't seen what was passed in the House.
Okay.
I'll clarify that. We passed a bill last week that added 8 additional conditions to current law, including autism, and so the Senate bill would just be only adding autism, only
Okay.
adding one
That's
condition.
where I was confused.
That's correct. Yes, sir. Chairman Representative Clark.
Thank you. Senator, I just have a question. Why, again, going with my colleague Caldwell, with going from 5 to 3%, what just kind of gets at me is why we're even, this is even a discussion. I think the discussion should be what conditions we are adding. And it just goes back to back in the 1990 something. Merck, the pharmaceutical company that created Vioxx, that killed around 6,000, that contributed around that many people dying. And I mean, it just kind of hits me as that's something, these opioids, those are things that are killing people left and right. And you can easily overdose on that. And we're not seeing any side effects. We don't have any studies saying that the 5%, there isn't anything to hurt the patients who are using it. We see the results that's helping. We know that taking from 5 to 3% could easily bring down the number of people who are able to use it because they might need it at 5%. And I know through the history of mankind, through using this, the medical cannabis, no one's ever overdosed. No one's ever died from it. And I mean, I just feel like we keep seeing one after another of results coming out of people being helped. It's not harming them compared to so many other pharmaceutical drugs. And I'm not saying we don't need these other drugs, but we know that they have harmful side effects. And it just kind of, I just don't even understand why it's going 5 to 3 when we have.
I got you. I did answer that, but let me answer your question in a different way. To say that it has no harmful side effects is absolutely not true. So, I mean, I've admitted patients to the hospital with THC side effects. The number of accidents in Colorado, I understand, have doubled. There are states that are measuring the amount of THC by serum because, you know, it is fat soluble versus water soluble like alcohol. To say that you don't have, because remember the CBD probably does not have the delusional or hallucinogenic aspect related that the THC does. That's well documented. Now the observational, and so I want to just pause there and make sure that we're accurate from that standpoint, because there are side effects of THC and they are real. Now we'll switch over to the observational data that has been shown in certain states that theoretically there's less overdoses relating to opioids because of associated marijuana usage. That's our observational data. That is not, you know, randomized controlled trials. That's what's needed. That may be that's what starts us thinking that maybe there is, because of this observational data and association, it may show that indeed that may turn out to be true. But that's what needs to be studied. I agree with you. It may look promising, but certainly is not there by any means.
Clark? Yeah. Let me just chime in there that, and you correct me if I'm wrong, but probably most cases that you're seeing those side effects, significant side effects, are from smoking. I would imagine.
Yeah, the delusions and hallucinations and so forth. That is from smoking, and it is probably
a
it is a higher
level
percentage.
Right.
For the most part. I mean, that's right.
I would imagine you're not seeing
but
patients.
But to say that the 5% or 3% is not going to have potential for that, I think is mischaracterization.
Yeah.
So.
But more than likely, the patients you're seeing who've had that probably were not getting it from medical cannabis oil at 5% THC.
You know, they felt as if they were using it for medicinal purposes. Yeah.
Okay.
And I've certainly had patients come in asking for medicinal purposes, you know, for where it's not indicated now.
Yeah.
And I think you may have dropped some of those diagnoses from your original bill.
Yeah.
But that's neither here nor there.
Okay. Let's see. Representative Beskett.
Thank you, Mr. Chairman. And Mr. Chairman, is there what is the distinction between autism spectrum disorder and severe autism? I looked back at the bill, House Bill 65 we passed in the House. We added 8 conditions, including autism spectrum disorder. Your change would imply that people younger than 18 are not diagnosed with that.
So autism spectrum disorder includes a wide range of diagnoses. So it can go from mild Asperger's to a more severe, profound autism that we well recognize. It was the Senate's position that If you were going to give it to small children in a developing brain, as we all know, the brain's not fully developed till about age 25 or 26, and for some of us it may not be developed even later. But the point is that if you're having a mild Asperger's patient that is getting something that has not been randomized controlled trials that may have potential for I mentioned the earlier side effects, but may have potential for long-term, brain damage, so to speak, to use layman's terms, then the Senate did not feel comfortable in allowing that in very mild cases of autism. So the autism spectrum disorder, as you know, was reclassified a few years ago, and the diagnosis was expanded, and the number of people diagnosed with autism spectrum disorder has been expanded, and the number is much larger than it used to be.
Thank you.
Senator Watson, if you don't mind, I'd like to kind of walk you through a couple of the changes that were made in the House version as well too. Get your input on those and see if you've got any opposition to them, because we made a couple of changes that were just more cleanup regarding HB1 that was introduced 2 years ago. So one of them was changing the reporting for doctors from quarterly to an annual basis. I'd get your opinion on that.
I know that, we had discussed earlier in the year, I think maybe back in the fall, about doing away with the registry and so forth. And I disagreed with that, and I think that the registry allows us to know that there are 300 physicians prescribing it, and there are about 1,300 patients receiving, and I think that's good data. I think if you do it from an annual basis, I think that that's going to be, it is going to be less onerous, certainly, but is it going to be able to provide the legislature enough data, for that? If you're going to do it every 6 months or so, I could certainly see that. I think to do it annually, though, may make it a little bit more, but I think that you make a good point.
Okay, it's just the reporting portion. It's not the actual registering. It's just the reporting from the physician. So
the number of patients that you're prescribing it for, right?
We eliminated a 1-year residency requirement too, because we've had a lot of folks who have said we're moving to the state. We've got a special needs child. We're moving to the state to live with grandparents, so forth. Comment on that?
Yeah, I think that's certainly something to consider.
And then we also removed the severe and end stage from 5 of the existing conditions, again, at request of patients and doctors who were saying, hey, it's just, we'd rather say they have a condition, they should be able to have access to it, not just when they're dying, but maybe to help improve the quality of their life. Do you want to comment on that as well, too?
Well, I remember when we put that in there, and that was back a couple of years ago. The end stage or severe aspect relating to a lot of illnesses. It gets back to the original question that I asked earlier. The first rule in medicine, do no harm, and the aspect related to randomized controlled trials. Yes, we have anecdotal observational data. So I'd have to look more at the details on that, but that's.
And then we added 7 more conditions besides autism. We added Tourette's, epidermolysis bullosa, Alzheimer's, HIV, AIDS, autoimmune disease, and peripheral neuropathy, as well as added hospice as being under hospice care as providing eligibility to be on the registry as well too. So 7 conditions plus hospice care. You want to comment on any of those?
So let me make sure we got that. Tourette's, EB, Alzheimer's, HIV, AIDS, peripheral neuropathy, hospice.
Autoimmune disease.
All autoimmune diseases?
Yes, correct.
You got some, there's certainly some severe illnesses that you have listed, but a lot of those have some mild aspects related to that. And you didn't put any age limits on any of that?
We did not, no.
I think it's something to look at.
Okay. Representative Clark, you got another question?
Yeah, one last question. Senator, last question I have is, what about the nasal spray that has been very effective but has been shown that needs to be at 5%? What would you say to that?
I'd say show me the randomized controlled trial.
One more question.
Sure.
Then if we have the 28 states that allow the medical marijuana, you have the 8 with no cap, the 14 with low THC, then since there are no I mean, I've not seen it unless you have it, the true evidence showing that we need to take it from 5 to 3, then why not keep it at 5 and let's move forward with, because since we have had nothing happening where it's showing, hey, we need to pull back, people are having these side effects, then why not stay at 5?
Well, I mean, I
Let's
think
talk
that's
about these conditions.
right. I mean, I think that is, what the patient, the physician, should be doing. I mean, you want to use the lowest dose possible generally in titration. So I'd sort of want to look at the numbers.
Last one.
And that may be something that we want to add in there, maybe the percentage of THC that we are. I'm sort of thinking on the fly here, but that's maybe something from a registry standpoint that could be considered.
As far as collecting data, you mean?
Yeah.
What percentage they're using?
Mm-hmm. That'd be interesting to know. We don't have that data, do we?
No, we do not.
Mm.
I think also, I mean, definitely through this whole topic of medical marijuana and all that, it's definitely a topic where, since it's a Schedule I drug, we're having to go off actual testimonies and seeing it firsthand in front of family, friends, and all that. A lot of the times, just because we're not being able to do as many studies as we would love to do. But I know, I've seen it firsthand on friends who have been using this medical cannabis, and it's helped so much. So I know, yes, you have to have the studies, but also when you see it firsthand and they're using it truly to better themselves through their conditions, I just see that the 5% is just why change when there's no evidence.
I'm right there with you,
Yes, thank you,
except
sir.
on the 5%.
Representative Gravely? Yeah.
Thank you. 2 questions. The randomly controlled testing, I think we have a trial in Augusta over the last 2 years.
So the Epidiolex is a no THC CBD oil, and yes, it is being done. It's GW Pharmaceuticals out of England, I believe, UK, and there are numbers there, and it does look promising from what I understand. The numbers are small though, so the people that actually can get into those studies are small.
That was my concern, was that the test is being done on a synthetic version of cannabidiol.
Mm-hmm.
But the numbers, I think we had heard that a lot of the people over the last 2 years who had tried or would have participated in a trial were prohibited due to age or amount of space availability, diagnosis. So that was a concern with some of the trials. And what's the average length of a trial? Once a trial is started, the results are then computed, and then the data's flushed back up for what would be the next step after that trial?
So I mean, if you have the, and I can't speak to this particular trial, but generally, once you have the data to reach, a confidence interval, we have the standard deviation that's met. So if you have the data, then it's got to be, submitted to a journal or to the FDA. It's got to be peer reviewed, and then it goes back and forth. So it is quite some time, and that's been going on, I think, for a couple of years. So it probably has a couple more years to go.
Gotcha.
Do you know?
Yeah, I think it's been in place since we started, since the year before HB1 passed, so it would have been 2014.
And it's pretty well defined, if I remember correctly. I think it's just used for epilepsy.
Just for
if I remember correctly.
particular
Just for
diagnosis,
epilepsy.
right?
Yeah.
And then final, you had mentioned, of course, as a physician, and thank you for your work, that you favor the clinical trials, the testing, the ability for us to get data. Would you, as a physician, support and then join efforts to urge Congress to reschedule from marijuana from a Schedule I to a Schedule II, so that that type of testing could be more available, it could be a little bit more widespread with our university systems here in the state of Georgia, even some medical facilities here in the state of Georgia?
I wholeheartely agree, Representative Gravely. When I spoke on the Senate floor, I called for President Trump and the DEA and the FDA. My words were to break down that wall, because I think it has a artificial wall that's been put up, is decades old. And I think to go to Representative Clark's point, to think that this drug, THC or CBD, has no medicinal value is crazy. I think that we need to study it. But unfortunately, we're in a catch-22, and we just put the states in a difficult spot. So unless they remove it from Schedule 1, because if universities or medical schools study this, then they will lose their funding or have the potential to lose their funding. So my recommendation, and I'm not the DEA or the FDA. I don't do the classification. I'm not in the Justice Department. I'm not under, Department of Agriculture like the FDA is. But there is a change of administration, and I'm hopeful, cautiously optimistic that maybe they will change it from a Schedule 1. Now, my suggestion would be make a new schedule, carve it out, make it a Schedule 1B, allow the rules and regulations or the law to say that we can study this and you won't lose your funding. I think that's what should be done, because I think a lot of that is still, it is unknown. And, what's the correct dosage? What's the correct percentage? So that's my recommendation. Schedule 1B, carve out, make a new one.
Any other questions? Okay. Just a couple of comments, and then we'll wrap up. There is a resolution in the Senate. I'm not sure if you knew about it. In fact, we chatted about it before you came in. Resolution 317, signed by Payne, Mullis, McCoon, Heath, and Anderson, actually asking for rescheduling.
Yeah,
that's
good.
I hope the Senate will continue to move that forward.
Absolutely.
And we're going to have one on our side that Representative Heath Clark has presented as well, too. One interesting, I know the Epidiolex trial has been a successful one. I think they've seen some good positive results. We have met a lot of the families that were on that trial who have come off of it and have gone on to another medical cannabis oil that does have some THC and have seen better results. So again, it goes back to we need more data, and I get that. But let me wrap up with a couple things, and then we'll kind of see what the will of the committee is. This body last week did take under deliberation HB 65. As I've explained to you, made the changes that I've walked you through, as well as add the conditions and keeping the THC at 5%, and passed overwhelmingly. I think 156 to 6, something like that. And so I think we saw a pretty strong statement from the House of kind of where our position is, just as probably you could say the same thing with the Senate's version. You and I go back a long way on this issue, and you were the second signer on the very first bill we ever introduced. And to your credit, as a medical professional, you stepped out, and it took a lot of courage to make that step. And I'm grateful to you, Senator Watson, and always will be, for you really being in the trenches when I think Chairman McCall and I and just a couple of us signed the original bill. And so I know you have a passion for this and a desire to see how do we help more Georgia citizens who are hurting and have debilitating illnesses, and so I'm grateful for that. We feel pretty strongly, and I think we saw through the House vote, that the THC level really is an issue, as Speaker Ralston has said so eloquently. This is an issue that we voted on, debated, and passed 2 years ago, and doesn't need to be messed with at this point. We also have seen very through the results of what's been going on for 2 years, strong evidence that the program we have in place is working, and that there are citizens who really have seen benefit from the 8 medical conditions that we now have under Georgia law. And so we saw strongly through the vote last week that it's time to take the next reasonable step of allowing more citizens to be able to benefit and with more conditions. And so I think you're going to see a pretty strong position, again, according to the will of this committee and the committee process, that we feel like we've passed a bill, HB 65, that is the kind of the proper next step. And so we'll look forward to continuing that discussion with you, and our Senate colleagues will too. Representative Bradley, you said you have a recommendation on? Yep.
Recommend that we would,
There you go. Once you hit, there you go.
we can't do amendments, right?
No, we can't do amendments. All
just
we're doing is making a
recommend.
recommendation to the committee, to the Judicial and Non-Civil Committee.
I would just recommend that to the full Judiciary Committee for consideration, that we move the THC from 3% back to 5%, and then add in the diagnosis that we added in House Bill 65.
Okay. How about as far as the other changes that were made to existing law? As far as the reporting and the residency requirements and removing severe and end stage and
I would essentially say that what we've done in House Bill 65, dealing with reporting, dealing with the end stage, dealing with the diagnosis, and keeping that THC level at a 5%, be recommended going forward for cannabis bills or medical cannabis bills that we're going to see, simply because we have debated those bills, we've voted on the levels. Even law enforcement and PAC has said that they have not seen any misuse or abuse. There's been no gaming of the system. I think our registry here in the state is working to what we hoped it would work for. And with the 1,300, I believe it's 1,300 patients that we are seeing positively respond to this, I want us to be able to help as many as possible. So that would be my recommendation for the committee to consider.
Okay, let me just rephrase that. So to the members of the committee, basically you're proposing that we take the language that was in HB 65 and replace it with what for Senate Bill 16.
That would be my recommendation,
Okay.
Mr. Chair.
Okay. Any discussion about that recommendation or any thoughts or for or against? Okay, all those in favor of making that recommendation say aye.
Aye.
Any opposed? Okay. Senator Watson, again, we can't make technical changes, so you'll have a chance to argue the merits of your bill and the contents of your bill to the Judiciary and Non-Civil Committee in front of Chairman Rich Golick next week, and but it will be communicated to the committee and to Chairman Golick that that's the strong recommendation from this committee. Thank you for your work on this. I think we're moving in the right direction, and look forward to getting a resolution together with the Senate.
I think we can work together.
I hope so too. Okay, we are adjourned. Thank you.